Hello, my name is Dylan Hofmann, and this presentation is going to be about a clinical improvement plan that I'm wanting to do. 5 steps that I'm hoping to implement into my clinical practice to meet the health literacy needs of my patients. To give you a quick summary of what these 5 steps are and why I chose them, I wanted steps that were going to be easy in a sense, or at least achievable to implement, things that I felt I could actually do in my clinical practice that would make a difference, and very feasible to implement. Real quick, and we'll dive into these more in depth, but I wanted to use the PMAX to assess my current patient education materials, create Spanish versions of my concussion policy materials, get Google Translate onto all of the technology that I keep on my person and in the clinic while I'm at work, include a teach back section in my documentation, and then make sure I'm able to purchase anatomy models for patient teaching. So we'll talk more in depth about the what, how, and why of each of these steps, starting with the PMAX. So PMAX stands for the Patient Education Materials Assessment tool. You can use it to assess both written documents and audiovisual documents, or materials that you use for patient education. Specifically, it measures and assesses how understandable are these materials for patients, and how easy are patients actually able to take action with these materials and use these materials. So that's what it is. As far as how, there's a lot of online materials to grade these. There's also an Excel sheet that, and that's kind of software that you can bring down that will actually kind of score it for you as well. But really easy, going to be able to get these online PMAT grading tools and then assess the current patient materials that I already have. And the reason that I'm wanting to do this is, one, I want to make sure that the materials I've been giving out to patients actually meet the health literacy needs of my patients. And I was just recently introduced to PMAX. Before that, I used things like the health literacy, or the reading level check on Word. But PMAX is definitely geared a lot more towards those healthcare education materials. So that's a big why of what I want to do with this. And if something's not meeting the needs of my patients, then I can make the edits to those documents I need. Secondly, my Spanish concussion materials. I want to create a Spanish version of the policies and documents, patient materials that I have for concussions. To accomplish this, I'm going to work with the ESL and or Spanish departments in my organization to create a Spanish version of the documents that I already have. And the big reason here is oftentimes when I have a patient, most of my patients are English speaking, but I do have a large number of parents who are not English speaking or do not speak English very well. Most of the time, I will actually work with the student, they're high school age students, and I'll work with that patient to communicate with the parents. The problem is if the student suffered a concussion, they may not be in a great state to work as that translator. And so making sure that I have some of these materials that are understandable for those Spanish-speaking parents and meeting their needs was really important for me. Then I have Google Translate. This is really simple, but I essentially want to have that Google translation tool to do those basic translations whenever I do not have someone else there to translate for me. So if I'm working with a Spanish-speaking patient and that Spanish-speaking patient doesn't have a translator with them, I don't have another translator available, I'll at least have this app. I'll download the app onto all of my devices in my work, my clinic. That way I can always ensure, and this is my why, I can always ensure that I at least have some rudimentary form of communication. Obviously, there's better translation tools in Google Translate, but it's free, it's easy to use. I've practiced with it a little bit, and it ensures that I at least have a way to get rudimentary information to and from a Spanish-speaking patient when I'm in the absence of a translator. And then I want to make sure that my next step is documenting teach-back. So teach-back or show-me techniques, these are things where the patient's going to show me that they understood or comprehended the education I gave them, either by explaining it back to me or demonstrating and showing a technique to me. And so I want to be able to use that. And I thought, well, in order for me to really effectively use that and remember to, because I've done it before, but be able to actually remember to always use that in my practice, I decided that I'm going to create a section in my EMR, in my documentation, and nothing crazy, just a simple check mark, that says, did the patient demonstrate comprehension through Teach Me Back or Show Me or any of these other lessons? And I'll check yes or no that the patient demonstrated that they understood. This helps improve my documentation for a multitude of reasons, but it also increases the likelihood that I'll actually perform or ask the patient to do that, because sometimes I do and sometimes I don't, but having that checklist there will jog my memory and remind me to always go back and make sure that we're using these techniques. And then finally is the use of anatomy models. So I currently don't have any in my practice, but I find myself a lot of times trying to draw things, using my own self to try and demonstrate, and it's difficult. I'm not a great illustrator, and a lot of people learn through visuals. So using anatomy models to aid in the description of pathologies, the description of movements, etc. A way I can do this is simply working with my organization to make sure I'm able to purchase some different models of those areas that are most commonly going to be seen in my practice: shoulder, spine, knee, and foot. And I can have those to demonstrate. For example, many patients benefit a lot from visual learning, and me explaining something in words and me showing them on a model can have a huge impact on how well they're able to comprehend what we're talking about. For example, if I'm talking about why does it hurt with a disc pathology during flexion, it's easier for me to show them how that disc can protrude and hit those nerves on a model than me trying to explain that in words. So having those models with me, making sure that I have those in my clinic will help with that. So those are my 5 action steps, and I hope that this was useful and some of these steps can be applied in your own practice. So thank you for listening to my conversation.